So another common injury in tennis and in a lot of racket sports is an ankle injury. Oftentimes you can sprain the ankle, either a low ankle sprain. Sometimes we'll get a high ankle sprain where you're actually feeling up into the tibia here. That syndesmosis kind of spreads, and that can be extremely painful. The length of time of recovery obviously varies for people, but sometimes a couple of weeks, sometimes even several months depending on the severity of the injury. This is where getting some rehab can be very helpful in expediting that recovery process. So there's going to be a couple different things we're going to do for a sprained ankle. First, we're going to obviously assess it. Oftentimes the pain is going to be right there on that ATFL ligament, and there'll oftentimes be quite a lot of swelling. In the acute phase, we don't want to mobilize it too much. That can be too painful, but we can do just a little, gentle traction down like that, just to help kind of spread that inflammation around, get a lot of blood flow, and just give a nice gentle stretch. We can also perform acupuncture as well on a subacute injury. And again, we're just going to take the needles and we're going to insert those in a couple different areas along those along the ankle here. That can be extremely helpful for reducing swelling, reducing pain, and helping you get better. Soft tissue techniques in through the ankle here, and these are generally well received and quite comfortable, and it can really make a big impact on improving the mobility of that ankle. And we've gotten people where they can't put any weight on it, and then they're able to walk out of the clinic about 10-20 minutes later. It can be really effective. We're going to do some very soft tissue techniques all in through the lower leg here to affect those muscles, because not only is there local swelling, but the whole kinetic chain is going to be affected because these muscles cross that inflammation, and then they're going to become a problem as well. After we've gotten the pain down, and once we're into that subacute and persistent stage, then we're going to get into some exercises. The simplest one I find is just standing on one leg. So just stand on one leg there, and then just doing this throughout the day. We're just trying to challenge the ankle in various movements. One common thing is if you do not rehabilitate a sprained ankle, I've seen this time and time again, people get those weak ankles and they always have to wear an ankle brace. It's because they don't fully rehabilitate their ankle. It's critically important. If you sprain your ankle once, more easily sprained and injured. So make sure you rehab it so it doesn't become a persistent problem down the road.